We are currently performing an implant procedure on our patient. Due to unsuccessful root canal treatments and fillings, we planned and placed implants in place of the extracted teeth. We are performing our procedure under local anesthesia, and after the local anesthesia, our patient does not feel any pain or discomfort. The procedure is extremely simple. It's not much different from other dental procedures. Waiting period. For this patient, the period we observe today is 3 months, but with the use of bone powder and additional surgical procedures, such as operations like sinus lift, we will wait 5-6 months in the area we operated on. During that time, we will design a temporary tooth for our patient to ensure they are not left without teeth. In this case, there is mixed dentition, that is, we did not extract all the teeth and apply implants. We preferred to keep the teeth that we could save and maintain in the mouth. We planned implants for the missing areas, approximately a 1-hour operation, an extremely easy and comfortable operation under local anesthesia. We will let our patient rest a bit and then prepare the temporary teeth. Afterwards, our patient will not need to come to us for 3 months. They will wait with their temporary teeth. After 3 months, we will complete the smile design. I wish you all healthy smiles. We have completed our patient's implant operation and it went very smoothly. In the next phase, we will plan and produce the temporary teeth. After completing the 3-month waiting period with the temporary teeth, we will finish our smile design with the first trial teeth.